We are here at the first Cancer Health Fair. It's being hosted by the Oncology Unit of the Tobago Regional Health Authority, the TRHA. And we have with us Ms. Samantha Corbin-Nancis, who is a registered oncology nurse. She's one of the coordinators. Mrs. Nancis, could you give us the theme of this event that you all are having and why it's taking place?
So the theme of this health fair is Dimensions of Wellness, She with an acronym S-HE to support, help and empower. Why we are having this health fair, it is the first ever health fair, is that we have realized that Tobagonians and by extension the whole community needs to be aware of cancer. Cancer is on the rise in Tobago and we see the need to have people be aware of healthy practices that they can adopt to leave out the destructive practices that may contribute to cancer.
According to Nurse Nancis, cancers of the breast, prostate and colon are the most prevalent forms treated at the oncology department. One cancer survivor is Onika Thompson-Tony. She was diagnosed with breast cancer in 2017. She underwent a mastectomy and is now in remission. She shared her story.
Somehow I felt I was less than a woman, but I realized I am not, and I've also realized cancer is no respecter of person, age, religion, color. It's out there, it affects everyone. The journey right now, it's getting easier. I attend the oncology clinic. I have nice support from the nurses there.
The health fair, which took place at the Gulf City Mall Lowlands, also focused on men's well-being. Prostate cancer survivor Michael Stewart shared the male perspective.
Yes, you can have an erection if you do the nerve-sparing radical prostatectomy. If you take the entire prostate out, the nerve passes through the prostate, and so therefore that is going to prevent you from having an erection. But once you do the nerve sparing, yes, you can have sex and you can continue. What am I saying? Men, there is hope. Don't neglect your health.
Facilitators provided information on how patients and caregivers can deal with a cancer diagnosis. Topics ranged from emotional support and spirituality to diet and financial management. Patrons underwent basic health screenings and interacted with medical, beauty and mental health service providers.
When you have a program where you can have hands-on, there's speakers giving you information, professionals giving you information, so that you can then ask questions, you can find out stuff, because knowledge is responsibility. And a lot of times things happen to us simply because we don't know. So it's definitely excellent.
The TRHA's oncology department is based at the old Scarborough Hospital at Fort King George. If you want more information about cancers and treatment options, you can call 660-4744, extensions 3450 to 3452. I'm Omodara Mills for Let's Talk Tobago.